which is why is skincare so important following surgery. So yeah, it is important. So in terms of skincare, skincare kind of scar care, if you like. So we talked about skin and scar management, and it normally starts at 6 weeks post-op. So that's assuming there's no healing problems. The first 6 weeks is the healing, so we have to get the wounds healed. And usually, in the vast majority of cases, it's dressings for a week and then no dressings. And as I say, the wounds should be healed in a week, but it'll be quite fresh. And so we normally leave it alone for 6 weeks. So you don't do anything for the first 6 weeks. You can wash, shower, get it wet, and all those things, but no, nothing in terms of managing the scar. After 6 weeks, that's when we start scar management. We will work with you with this, but the majority of cases, it's moisturizer massage is the regime for scar management. Depends on where it is as to how often you can do it. But you know, if you can, moisturizer massage to break down that scar tissue. And when we see you at the 6 week mark, often the scars are quite red, they're quite active, they're quite firm, they feel quite firm, and you can tell that there's still quite a lot of activity, quite a lot of scar tissue there. So we get you massaging to help break down that scar tissue. And it does take time, it takes several months for that to happen. And in that time, we always taught you about avoiding sun exposure, because if you get a tan on that scar while it's red and active, it will give you a pigmented scar. You'll end up with a tanned scar. You'll lose the tan the rest of your body, but the scar won't lose the tan if you get a tan on the scar while it's red and active. So you have to be really careful with that skin while it's active and while it's healing. The majority of cases it's moisturizer massage. If they have a problem scar, then you can look at other things. A problem scar being a hypertrophic scar or even a keloid scar, which are kind of raised red scarring. If you have a problem with the scarring, there are other things we can do. Things like silicone, which can come as a gel or a tape, steroid injections. Those are the kind of two mainstays of treating hypertrophic scars. But the majority of the majority of scars do not need that. It's only if you have abnormal scarring. A lot of people talk about steroid or not steroid, silicone for normal scars, and we tend to advise massaging for a normal scar, inverted commas, and it's only really for the red, raised, hypertrophic, overly active scars that we talk about silicone and possibly steroid injection. But you know, we'll talk you through it and we'll work with you through it, because you know, one of the main things I say about the practice is the aftercare is as important as surgery. It really is important to maximize the scarring, get the best scar you possibly can, because obviously that's a huge part of this sort of surgery, because all of the surgery pretty much has got big scarring and kind of often prominent scarring. If you're doing moles, cysts, lumps and bumps, are often on the face, because that's where you're going to be more bothered by them, so more likely to have them removed. So we've got to make sure that we make those scars as good as we possibly can. And so post-op scar regime is really important, and I will work with you, Vicky will work with you to guide you with that scar management to make sure it settles satisfactorily.